2018.
I see the Minister of Health, Minister Mbombo.
Deputy Speaker, Honourable Premier Helen Zille, the Cabinet colleagues and members of the Provincial Parliament, the Chairperson of the Standing Committee, the heads of the department and the management that are here, our partners in academic institutions, civil society, the health sector, the clients, our special guests representing local communities, our consumers of healthcare, our partners in the private, and most importantly, the citizens of the province. The media, if it's here, good morning. My speech won't be long for the first time. It won't have a long speech, but it will be centered. I'm focusing more on showcasing the department's resilience as it continues to provide health services for 24 hours, 365 days a year to over 14 million patients when you consider the head count per annum amidst the current economic climate and the system challenges. Deputy Speaker, health continues to face a growing prevalence of disease in a growing population. The disease profile has become increasingly complex over the last decade as patient comorbidities have been seen to be increasing. We also faced unintended consequences like the fire disasters, for example, in the Swartland Hospital, Knysna Hospital last year, and recently the Grooteskier Ward and the Mitchells Plain Ward, as well as the drought. So there's fire, there's also water shortage. The department has a water preparedness plan in place as water is an essential part in terms of rendering health services. Hospitals are large consumers of water, and many of the essential services can only be provided if there's a supply of potable water. In cooperation with the Department of Transport and Public Works, we have already commenced with drilling boreholes at several hospitals as a precautionary measure. This is in addition to the other saving water mechanism, for example, theatre, surgical, scrubbing. A number of priority sites have also been identified based on the importance of the site in the health system, how many people served, for example, as well as the local availability of municipal water. So far, we have prioritized almost 72 in total of the sites, and also according to the phases. For example, one of the phase 1 sites, it's a Tygerberg Hospital Estate, Grooteskier Hospital Estate, Red Cross, Lendegier, as well as other rural district hospitals. Recently, I visited Lendegier Hospital Estate to inspect the water security efforts on the ground, and I'm pleased with the progress made to date. The Lendegier Hospital Estate, just for those who are not familiar, it consists of the rehabilitation center, which is more than 300 beds. There's a school there, and also caters for the Mitchells Plain Hospital that is next door, plus also the Lendegier Mental Health Hospital. For example, the boreholes were part of a phase 1, and already the estate has 10 boreholes in total existing in the new boreholes, and the installation of the 800-meter long, 160 millimeters in diameter main pipeline that is underway. They are also installing a booster pump and working towards recommissioning almost 700,000 liters reservoir of water. Also, we also face outbreaks like listeriosis that claim 29 lives in the Western Cape to date. That is why it is important for us to continue to create awareness amongst the communities, which is outside the health facilities. I also need to mention that the head counts on when we do the outreach in these areas, for example, going to the taxi rank, to the train station, and all of those, they don't form part of the head count that we are in terms of being funded to do. So these are things that we do in addition to all other things that we are supposed to do. Now, in response to service pressures, the health system, for example, has implemented various strategies in place. We are implementing short-term efficiencies and cost savings to address the budget shortfalls. We acknowledge, firstly, our coalface staff members who experience pressures at various facilities. Those who have witnessed the conditions on which the health professionals have to work under, where you find gag violence continuously flaring up, Now you will understand how tall a task it is for health professionals to always place the needs of the patient above their own. I just want to commend every staff member for their resilience within this high-pressured working environment. We know the conditions that they work under, and we know that it's not easy. It's definitely not easy. However, there are things that we have put in place. For example, the mere fact that we are the only province so far that have prioritized and revised junior doctors' commuted overtime so that to reduce stress. For the first time that we have paid danger allowance for those health professionals, nurses specifically, working in selected mental health units. As part of the national directive, also, we have paid danger allowance for the forensic pathology officers, in addition to appointing additional forensic pathology officers, plus also the registrars, to relieve the pressure on the current FPS officers. We are currently also revising the organizational structure because it is crucial to make it a point that we protect the clinical side. And unfortunately, we have to reduce the administrative part of it. And in spite of all of these challenges we have, the mere fact that in terms of the Barrett survey, in terms of the entropy levels, we found that actually it shows that the staff morale is getting better compared in the previous where it was really bad. So we want to commend the staff for being able to be always having a positive attitude in spite of all of these challenges. Deputy Speaker, we have undertaken some of the initiatives, as I indicated, in terms of our transformation strategy, which is a management efficiency and alignment project, in short MEAP, MEAP, which aims to improve the efficiencies in administrative structures, functions, and processes across the various levels and offices within the department. The overall aim is to achieve at least a 10% saving in the managerial and administrative support services, so to protect the clinical sides of the service. In addition to that, because I mentioned that I'm focusing on the department resilience, what is that we have put in place? Because we cannot keep on complaining, and then we're not doing something about it. The e-vision, last year I spoke about introducing the e-vision, which is the digital innovations in the health system environment. Since the implementation of the e-vision last year, we've made great strides with a roadmap of priorities. We are close to achieving full coverage of the basic IT systems across all 52 hospitals in the provinces. If you recall last year, I spoke about the e-discharge, the e-referral, the e-pharmacy. So I want also now to share about our electronic continuity care record project, which is the ECCR. We made a significant progress with the rollout of this system, and has been implemented at 80% of the fixed health facilities, hospitals, and primary health care facilities in the province. The overall aim is to improve the continuity of care of the patient between the hospitals and primary health care, and also allow for the recording and capturing of vital information about the patient encounter, which helps to inform the burden of disease. The other digital space is the unique patient identifier. In practice, this means that when a patient's details are created initially at any of the province's hospitals or primary healthcare facilities, or any of the local government healthcare facilities, that patient's information is immediately identifiable and available at all other public health facilities within the province. This reduces waiting times for patients, assisting in improving the patient's experience, meaning Norma French in Bombo attends clinic in Beaufort West. Even if she goes to Vredendal, there's no need to take a lot of time getting more information and then starting to ask about the history. You can just look into the system. There'll always be one Bombo. Other thing, Deputy Speaker, it's about a partnership, public-private partnership. Government cannot do it alone. We have to work into partnership with the others. So I'm proud, for example, to share in terms of the last years what we have done in terms of accessing the access and the quality of health services for the population working with a private. One example, the Children's Hospital Trust, where they've completed an upgrade project to the value of 130 million at the Red Cross War Memorial Hospital This included, amongst others, the pediatric ICU and first ever radio station by children, for children, which is broadcasting from the hospital. The Children's Hospital Trust is also upgrading the neonatal unit of Provincial Hospital to the value of 46 million, and it will be completed in Feb 2019. The other partnership is the Petro SA, which has been invaluable for the upgrading and expanding the existing clinical facilities in Mosselbaai. The project was accrued to the value of 6.7 million, and another one that they are busy key to do is the building of new clinic in Alsa community to the value of 16 million, and estimated completion is within this calendar year. Also with the academic institution, for example, UCT, where they are funding the development of a neuroscience center at GSH over the next 4 years. Mediclinic, I see Mediclinic is here. For example, also continue to provide support. Recently, I witnessed in action at the Mediclinic Durbanville, the Da Vinci robotic surgery was used as part of the ongoing relationship with them, together with the Western Cape, with the urologist, Dr. Javi Brewer, providing cutting-edge prostate surgery to a patient that was on the Tygerberg Hospital's urology waiting list. I must stress that you take patients who are already on the waiting list, and then they are assisting in terms of reducing this late. Other current partnerships include over 400 contracted service providers. For example, the Clicks Group, the Discam, I see the Clicks is here, and other retail pharmacies rendering the health services using our stock. These services, for example, include family planning, immunizations, HIV counseling, and testing. So the collaborative service models between public and private sector have proven to increase patient access to care. We are also exploring further collaborations, not only with the private sector, but also with the NGOs. And I'm proud also to announce that currently we have discussions now with the Hospital Association of South Africa, which is the group of the private hospitals, to explore the possibilities to pilot universal health coverage, that is favorably known as NHI. So universal health coverage will be the first in the Western Cape, although it was not necessarily the Western Cape policy there. Deputy Speaker, the need for transformation and redesigning the way we do business has become a critical and urgent imperative. So that's why we're working towards service redesigning. So the whole service needs to be redesigned. We cannot do business as usual. And two of those that I can mention is what we call community-oriented primary care, COPC. The primary health care platform is a priority area, hence you'll see even in the budget, it has got the bigger slice on the district health services. COPC is a priority also in terms of achieving universal health coverage because it includes the total population in your geographic area around the primary care facilities, also involving other service providers. For example, the municipalities in the metro is the city, the private sector. Furthermore, it necessitates a strengthening of home and community-based care. This approach also further enhances the promotion of visible management at coalface. You no longer see now our managers sitting somewhere in their offices, so they're as part of the community-oriented primary care. The other approach in terms of service design is a whole-of-society approach, in short, to call it WOSA, W-O-S-A. The whole-of-society approach is a reinvigorated way of addressing the challenges we face with the communities. This also will form part of the PSG3, if you recall, when we introduced the provincial strategic goal, which is number 3, health, which aims to provide safe, socially connected, resilient, and empowered communities. We want to provide communities with equitable access to services and opportunities through the alignment of resources, collaboration, and partnership by all spheres of government. The head of the department, Dr. Beth Engelbler, who's leading this team of 5 HODs, because it's crucial that we have to have a transversal approach, showcasing how we work transversal across the departments to achieve our goal. So within the WOSA, we'll find that we have targeted different areas, geographic areas. In the metro, we have Khayelitsha, specifically around the town too. We've got a Manenberg and Hanover Park site. In the rural, we have got Saldan and Drakenstein. All these 5 HODs, each and every one is in charge of each area. Yet, in terms of the work we do, all the projects are happening there. For example, if you look at the PSG3 progress, Deputy Speaker, we are determined to continue with our health-led PSG3 and our projects that are currently are there, part of the PS3, the young women and girls, the first 1,000 days, Western Cape of Wellness. I'm only mentioning those that health is involved with, and also the alcohol and game changer. I'm happy that, for example, for WOW is one of the projects we successfully implemented, and the aim was to focus on the upstream factors targeted toward non-communicable disease such as diabetes, hypertension, and obesity. There's been numerous notable achievements seen in participants who at GSH performed a groundbreaking surgery by successfully treating a brain tumor through an eye socket. Such an operation has never been performed in the world, I'm told. GSH performed its ever bilateral sequential lung transplant in the Western Cape, and at the first in the state sector, national. At Tygerberg Hospital, for example, Professor Pierre Houssard, a pediatric pulmonologist, performed the first bronchial balloon dilation on a premature baby weighing 2 kgs. I made an example, for example, of the robotic interventions. At Victoria and Mitchells Plain District Hospitals, robotic knee surgeries were performed for the very first time at a district hospital level. I also want to acknowledge Professor Heather Zah, named as a 28th woman in Science Laureate in recognition of a wide-ranging contributions to child health, which have improved and saved children's lives across the globe, as well as shaping the international policy. The prestigious award is given annually to 5 women scientists worldwide, 1 from each continent. We thank all our clinicians for their hard work and dedication to improving the lives of our people. Now, Deputy Speaker, I want to come to the infrastructure. In the past financial year, we have built and replaced and upgraded, for example, I cannot count all of them, but Hillside Clinic replacement in Beaufort West, Red Cross War Memorial Children's Hospital, that is the PEDS ICU upgrade, in partnership, of course, with the Children's Trust, Khayelitsha Hospital CT scan, and the ward that has been completed, the Prince Alfred Hamlet Clinic, for example, that is replaced. I'm just mentioning the few. And in this financial year, that District 6 Community Center is already functioning, and it will be officially opened this year. Napier Clinic in Overberg District, which was completed late last year, will be also officially opened this year. It's about 5,000 square meter facility, replacing the existing one, which was too small, and it now is bigger and better and more equipped to respond to the needs of the community. George, you are also not left behind. Tembalé to CDC is also going to be completed and will be opened also this year. Other major projects in the metro, which is I cannot count all of them, for example, the Observatory Forensic Pathology Lab, which is well underway and be ready for commissioning in Feb. The whole details about infrastructure, they are in the APP. Now, lastly, about the staff safety. Deputy Speaker, the safety of our staff members remain a challenge. Staff safety has been seen as a priority since the attack, for example, of our 95 EMS staff members during the previous financial year, as well as threats to health professionals in high crime areas. And we are pleased to report a decrease of just under 50% of the last financial year, with the number of events reported now being declined to 49 for the EMS. We also want to acknowledge the role of the SAPs, plus also in some of the witnesses who made it possible for the conviction of some of these crimes. We'd also like to express a special word for thanks and appreciation to our colleagues in the City of Cape Town, with a special mention to MACO member JP Smith and his team for their commitment and support to our men and women in green. And through our collective efforts, we have been able to commission our EMS desk with the city's safety and security cluster and the Transport Management Center, and in so doing, create a network of support that enables EMS to those citizens, especially serving in those red zones area. The desk is staffed by a member of the team who's able, at the moment's notice, mobilize resources from within the city and subs, but more importantly, through the city's neighborhood watch desk. This illustrates my belief that the provision of an effective healthcare involves all stakeholders, partnerships, but not only more than only the citizens, but everyone else. And I want to acknowledge the subs, the Department of Community Safety, for making such a collaboration to be possible. It is really, truly an example of a connected and committed government. And whilst I mentioned the EMS, we also take into cognizance some of our staff members there in the health facilities, at the hospital, at the clinic, where they are constantly being attacked, because it's not only the EMS. Now, going to the finances, Deputy Speaker, I just again, firstly, to thank the HOD and the top management here for their hard work and dedication. My heartfelt thanks to you and your team for ensuring that we do not let the people of the Western Cape down. In spite of that, there have been budget cuts and also the economy that is not improving. I would like to commend them for their 13-year record of an unqualified audit. We are the only national department, provincial department nationally for having such a record. Clean audit in terms of the financing for the past 3 years. Clean finance for the, clean finance audit for the first time. We are the only health department for the whole at the national level in terms of the provinces. This reinforces public trust in the way that we manage the public purse. So I rest easy now when I table the 23.64 billion budget, knowing that it will be treated with the utmost care and spent to the benefit of the people. Just taking a note that this is the health received the largest budget allocation from the province. Also, the Department of Health in the Western Cape is the one that gets more funding from its province, whilst the others, they are even below the national norm. So 37% of the provincial slice comes to health. Of course, we had a shortfall of about 430 million, but we want to also to thank the Premier and the Treasury for trying to meet us halfway around that. Now, in terms of the budget allocations, from an economic classification point of view, the budget allocation includes 13.6 billion for compensation of employees. Remember, I've got about 32,000 staff members. 59% of the total budget goes there. 32% of the budget, which is 7.3 billion, goes to goods and services. 6% of the total budget, which is about 1.3 billion, goes to transfers and subsidies. 3.25% of the budget, which is 747 million, goes to capital assets. We also receive national conditional grants, national tertiary services grant at 3 billion, health facility revitalization grant at 678 million, health professional training and development grant at 574 million, comprehensive HIV grants, which is a 1.5 billion, which has been reduced nationally. And now, in terms of the programs, Program 1 administration is allocated 3.95% of the vote, and this amounts to an increase of approximately 42 million, which is a 4.93% increase. Program 2, the district health services, which is the biggest, is allocated 40.6% of the vote. This amounts to a nominal increase of about 551 million, which is a 6.33% increase. Emergency medical services is allocated 4.7% of the vote, and this amounts to a nominal increase of approximately 49.4 million, which is a 4.7% increase. Program 4, hospital services, allocated 15.7% of the budget, a nominal increase of about 161.3 million, which is about 4.72% increase. Program 5, central hospital services, allocated 27.92% of the vote, a nominal increase of about 4.73%, that is a 287.5 million. Program 6, health sciences and training, is allocated 1.47% of the vote. It's a nominal increase of about 19.3 million, which is about 6.09% increase. Healthcare support allocated 2% of the vote, this amounts to nominal increase of 18.4 million or 4.18% increase. The laundry services is allocated 23% of the vote, and that is nominal increase of approximately 1.39%, and it's a 1.4 million. Engineering services is allocated 21.65% of the vote, and this is a nominal increase of approximately 4.3 million and a 4.86% increase. Forensic pathology services is 38.7% of the total budget, and this amounts to a nominal increase of approximately 11.3 million at 7.26% increase in nominal terms. Program 8, Health Facilities Management, is allocated 3.53% of the vote, and that also, this translates to approximately 30.8 million and 3.69% of the vote. So, Deputy Speaker, here I'm tabling now the 2089 budget for the Department of Health. While the economic climate remains a challenge, as well as challenges within the health system, as a government, we are committed to add public value by providing quality health care to the people of this province. We cannot afford to rest on our laurels. We need to come up with innovative ideas on how best we can alleviate pressures in the public health system, which is under current financial constraints. Most importantly, we need to keep in mind the needs of the clients that we serve. None of the incredible work we have done would have been possible without the support of the staff. We do know that there are so many things, there's a lot that needs to be done because our population has increased, as I indicated, but at least we are doing something. So that's why I want to thank the Premier and the Cabinet colleagues for allowing me to moan and tantrum when I demand budgets and all of those. So they heard my tantrums. And also the members of the Provincial Parliament, specifically the Standing Committee, also for making us account. And also even their presence, because when we ask them to come to some of our events and all of those, they're sitting there. Thank you. My ministry office staff for their commitment and resilience, they know that there are more than 24 hours in a day. You only sleep when you are dead. And lastly, my family and loved ones for their support and understanding that the work of a minister is never done. I table the 2018-19 health budget of the Western Cape. Thank you.
Order, Honourable Lorraine Botha.
Deputy Speaker, I commend Minister Ivan Meyer for ensuring that the largest chunk of the Western Cape's budget is allocated to the Provincial Department of Health. I therefore welcome the appropriation of just over 23 billion rand, as this appropriation will assist the department in achieving its vision by ensuring that residents have access to person-centered quality care. With a growing population in the province and the majority without some form of medical aid, this sector plays a vital role in providing health services to residents of this province. Minister Nomafrench-Mbombo highlights an important point in her foreword of the annual performance plan for the 2018 financial year. She states, and I quote, "The demand for healthcare continues to grow, and this is unlikely to change in the short term, given the trends in the social determinants of health and well-being. A worrying trend is the increases in the people that are presenting with multiple, interacting and compounding health problems. This situation places the provincial health system under enormous strain, and in the context of significant budgetary constraints and the drought, 2018-19 is likely to be a very challenging year." Close quote. Deputy Speaker, what I've just mentioned highlights the reality of what we faced within the Western Cape. Yes, we have received the largest chunk of the government's budget, but the question is, will it be sufficient to address the healthcare needs of patients seeking public health care. In the Western Cape, we aim to address these types of questions. It is with this in mind that I am pleased to note that as part of the 2018 financial year, the department developed a transformation agenda to give full effect to the strategic vision of Healthcare 2030. This particular agenda is based on 3 pillars. In summary, these 3 pillars includes the core business of service delivery and patient care, with a focus on service design, strengthening leadership at all levels of the department, and finally improving the quality of governance, both internally and externally, through the management and efficiency project. This speaks directly to person-centered quality care. As challenging as the year might be, and amidst all the challenges that the department has experienced, person-centered quality care will be delivered in the Western Cape. What is important, Deputy Speaker, is that all of our patients should experience the same level of service at each of our facilities. When we talk about person-centered quality care, it shouldn't only be lip service, but an actual experience for that person who is using our facilities. It is for this reason that I'm pleased to see that more and more patients and their families are making use of the complaints and compliments call center. It's vital that we kept informed about the level of service that our residents are receiving, but also vital for the department to work on improvements. Deputy Speaker, this department's 2018-19 budget consists of 8 programs, as alluded to by the Minister, and when we refer to providing person-centered quality care, we have to ensure that the relevant and necessary infrastructure is in place to achieve this vision. I would therefore immediately like to attend to Program 8, the Health Facilities Management. This particular program's purpose is to provide new health facilities while also refurbishing, upgrading, and maintaining existing facilities. This also includes the health technology. Allow me then to welcome the allocation of over 378 million rand to this program. This particular program also has sub-programs. I'm especially pleased to note that as part of the district hospital services sub-program, the upgrade completion of phase 2B of the Vredenburg Hospital will be underway. I'm also pleased that the new Observatory Forensic Pathology Lab, which is replacing the Salt Rivers facility, will be under construction. One can never underestimate the important role forensics plays in the health sector. It is therefore vital that our facilities are constantly improved to address the various needs that may arise. Furthermore, as part of our community health facilities, 9 of the 20 envisaged projects will either be under construction or be handed over. Minister, however, in the past, the timelines for the completion of infrastructure programs had its fair share of challenges, where projects have not been completed in the projected timeline. We're fully aware of the fact that you work hand in hand with Public Works and would therefore like to hear from you about how the 2 departments will ensure that these challenges will be addressed. Deputy Speaker, there are challenges, but this department's commitment to providing person-centered quality care within high-quality facilities tells us about the caring nature of the DA-led Western Cape government. Given the budget allocation to the City of Cape Town, Minister, I must inform you that I'm looking forward to hearing about the progress that's being made with the establishment of the Joint Steering Committee pertaining to the integration of health services between the city and the province. I mentioned earlier that it is vital that at each facility, the same person-centered quality care is experienced. Another sector, Deputy Speaker, in the Health Department, the emergency medical services, had it quite tough over the last year or so. The Minister has also alluded to this. This is one of the most critical services within the Health Department, as they are on the front line absence, and especially the broader community for assisting in the safekeeping of our EMS staff. We have already seen how severe our courts have been with those criminals who sought to violate, attack and harm our EMS staff. Deputy Speaker, I'm also pleased to note the increase, albeit the nominal amount of just over 62 million rand for the emergency medical services. I'm of the view that it will further assist the EMS to continue being effective in their work. We need to continue ensuring that our EMF staff remain safe wherever they're working, and I'm therefore looking forward to hearing from you, Minister, as to how this increase will not only assist in the safety of EMS personnel when they execute their duties, but also assisting in reducing the number of red zones that we currently have. Deputy Speaker, there are times when we take this department, when we take the development, training and empowering of our health workers for granted. Program 5, or the Central Hospital Services, which includes the Provincial Tertiary Hospital Services, says that it's vital that a platform is created for the training of health workers while also conducting research. Further, this program also prioritizes the improvement of service delivery, the quality of care and patient experience, while strengthening the health system. Minister, one of the complaints that we also receive from communities is that healthcare workers have bad attitudes. When we then refer to training, are we also ensuring that this is and will be addressed? Person-centered quality care must be a lived experience. With an allocation of just under 28% of the department's budget, which amounts to an increase of over 356 million rand compared to the previous year, this will enable the department to achieve the program's set outcomes. Allow me also, Deputy Speaker, to welcome the 15% allocation to the Provincial Hospital Services. The allocation is an increase of over 210 million rand. It is a nominal increase, but given their programs, particularly aims of ensuring that hospital services are accessible, appropriate, effective, and are able to provide general specialist services, I'm of the view that the increase will assist the department in achieving its aims. Deputy Speaker, given our water crisis and the understanding that health is a critical service, I commend the department and Minister Mbombo, who has since November 2017 been proactive with a water preparedness plan. Amongst others, more than 14 million rand has been allocated to boreholes at health facilities, the continued installation of water storage tanks, and the combating of leaks are some of the interventions at health facilities. Also, as there are groundwater projects and other engineering initiatives that also continuing into this new financial year, the department is committed to conserve water, reduce its usage, so that they are also able to mitigate the effect on service delivery. Deputy Speaker, no other province is as proactive in the health sector as we are in the Western Cape. No other province is as caring as we are. We're fully aware of how the sector is falling apart in places such as KZN. And I hope the ANC has looked at the television yesterday when it was highlighted, where the oncology department in KZN is non-existent. Then there are places such as Gauteng and the Eastern Cape, where civil claims due to negligence are running into the billions. The colleagues across the floor are fully aware that it's only under a DA-led government where person-centered quality care can be and it is experienced. And by no means, Deputy Speaker, are we saying that there is no room for improvement. However, we have to ensure that we seize the opportunity by continuing to improve on how we deliver health service. I commend all staff at the coalface of service delivery within of this province. The DA support.
The MEC has talked about the Voice of the Patient program. And I want to remind the MEC that on the appointment of the boards, not a single member this side of the House has been appointed. Dat laat ons nogal baie wonder of die gemeenskap buite net deur die DA gediens word. Maar ons gaan terugkom met daai een na ons staande komitee toe. Contrary, Deputy Speaker, to what this department is telling the people, the ANC welcomes the increase in both the equitable share and the conditional grants from the national government. It shows that indeed the ANC government is a caring government. What we cannot welcome is this department's move to retrench staff across the province. With a critical skill shortage in this local health sector, we are opposed to the move to decrease its budget for Program 6, the Health Sciences and Training. It is also cutting expenditure for machinery and equipment, as well as software and other intangible assets in Program 2, 4, and 5. That is concerning, since this means that apparatuses most needed will not be in our district hospitals and community facilities. But the department is telling a different story, painting a rosy picture that all perform well. If one were to believe the words of the Honourable MEC and the DA, then we would have to be forgiven for believing that here we have one of the world's best run health departments. The only problem is that what is happening on the ground, which is what people experience, does not correlate. The reality is that here we have a department mired in crisis. And this budget gives an indication that things are going to get worse. I believe this is a budget to tumble down and collapse the healthcare system in this province. Instead of dealing with the issues head-on, the department is sugarcoating things and coming up with plans and excuses. These excuses and ineffective plans are outlined in the APP, which will be supported by this budget. These include the community-orientated primary care, service redesign, service priorities, leadership and culture, and management efficiency and alignment project, MEAP. With all these plans, we still witness marches by nurses to the legislature, like the one yesterday. How can all these plans fail to address the issues raised by the nurses in front of the legislature yesterday? They came to represent the views of the people about this department, as well as the plight of nurses in this province. They basically say this department doesn't care about the well-being of nurses. This department is violating the rights of workers and mistreating its workers. All this was summarized in the words of STAR's two qualified nurses, Sisters Charmaine de Villiers and staff nurse Charlotte Peterson, for wearing a gillet as part of the uniform. Many petitions were forwarded to the department opposing this decision, yet the two nurses, breadwinners for their families, are still out of jobs. And it's not a joke, Mackenzie. Florence Africa, the previous director, sent a letter during the arbitration stating that the directorate didn't support the sanction of dismissal. Key to our opposition of the decision was that there is no uniform policy in the country. Everybody agreed that dismissal was not the proper way to deal with the matter at hand. This department dismissed the two because they were outspoken and criticized things that were not right about this department. Honorable MEC Mbombo was sent many appeals according to them and never responded to any of them. The dismissal of these two will go a long way to highlight the abuse of nurses in this department and how critics are silenced using dismissal as one of the weapons in the department's arsenal. It clearly shows that to this DA-led administration, health personnel are just mere robots who don't have rights, who don't have families to feed, and who don't get tired and not deserving of any rest. This department doesn't care about the plight of nurses. It certainly doesn't care about their feelings and well-being. It is not surprising why this department has one of the highest rates of absenteeism, which in their words can be ascribed to workload and other related matters. The department also has one of the highest staff turnover rates. It has also admitted that the recruitment of qualified and skilled health and technical professions pose a challenge due to scarcity of skills. Yet, Nurse de Villiers has got masters and is one of the very few best trained nurses in this province. But this department dismissed her just like that. It doesn't only end here. This department is also cutting the budget for Program 6, which deals specifically with training and bursaries for healthcare personnel. Where's the logic? You complain on the one hand that there is a crisis of skill shortage, yet on the other you cut the budget for developing those skills. You complain about the difficulty to recruit and retain skilled employees, yet you ill-treat and in the end complain about the high staff turnover. Sadly, the people who suffer the most due to poor leadership are the poor patients and the destitute. The biggest crisis in this province is not the water shortages, Deputy Speaker, but it is health, care, and poor leadership qualities displayed by this MEC. When the DA ousted the past MEC, Tiens Botha, because of internal factional fights and replaced him with an academic who had no governance experience, we raised these complaints. We are vindicated because now this health department in the province is on the brink of collapse and there's a leadership crisis. The leadership failures are vivid in how this department poorly handled the present listeriosis outbreak in the province and resulted in the second highest number of deaths and the concealed 2015 outbreak where at least 3 patients died. It is also visible in how it has handled the crisis in the EMS program. It is said, and I quote, and I do my oversight work with pleasure and with love. I open this quote, and this is in the words of an EMS personnel. The management of the department is out of touch with reality on the ground. Money is wasted outside of key objectives. There is a huge shortage of ambulances and equipment. The control room has a vast shortage of staff, unquote.
Is that true, French?
The DA always brags about the broadband game changer, and how it has availed internet access to many, especially unimportant government departments. But the EMS personnel are denied access to internet to do their work better. Instead of developing productive apps, it bans it. Many doctors use apps in their work. Why not other staff too? These claims are proven correct as the department cuts its budget under Program 3. The budget for the planned patient transport, which already caused headaches to the health practitioners in the province, will be cut by a further 4%. Again, we ask, where is the logic in that? EMS personnel were attacked everywhere in the province, which made it difficult to reach certain areas fast. The communities expected that at least there would be a program to provide some form of security for the EMS personnel. There is none in this budget. Instead, this department decreases its expenditure in the program. It is really shocking and disappointing to have this situation. The real losers are the patients that sometimes have to wait for 5 hours and more to be assisted. I want to relay a story which I saw on a Facebook page on January the 22nd, and I quote, Amy, a young child, broke her hip, and she called the emergency ambulance number several times since 1930 hours. She had to continuously explain to the same person that kept on answering the phone that they couldn't move the child as they didn't know the extent of the damage. She explained further that the child has osteogenesis imperfecta, and the name for that is brittle bone disease. Am I right, doctor? And the hip looks badly broken. She lay in the sand, and it's starting to get cold and dark. The control room operator kept telling her an ambulance will be on its way as soon as one is available. Only at 2115 hours, she finally said an ambulance is on its way, but at 2200 hours, she told her that nobody was available. She asked the operator if she expected to just leave the child to lay in the sand overnight, after which she called a private ambulance service, even though Amy and her mother can't afford medical aid. Both private and metro ambulances finally arrived at 2230 hours, with the metro EMS driver's female partner sleeping in the front seat. Pain medication had to be brought by another ambulance as it didn't have morphine. It arrived 30 minutes later. At midnight, Amy was finally lifted off the ground. According to the Metro EMS staff, they got a call with a code that it is not too urgent and a note that a child is having muscle spasms. The Metro EMS female made excuses for sleeping, saying they just don't have enough staff, so they have to work 12-hour shifts 5 nights in a row, unquote. There are many similar stories out there about the poor services rendered by the EMS personnel. Just read the daily reports in newspaper. This budget's response to such challenges is through cutting expenditure. The DA, through this budget, is also saying to people of this province that the shortage of emergency personnel will worsen this year. There is no provision for the hiring of more forensic pathologists. With all the bad state that our hospital buildings are in, Program 8.5, which is responsible for planning, design, construction, upgrading, and maintaining of central hospitals, is being decreased by a further 16%. I want to remind the MEC that Geef Jooste Hospital has been destroyed by this administration. It lied to the people and said it would be refurbished. It lied again and said they were going to rebuild it. Then it said it is relocated to another site. To this day, the people of Manenberg are still clueless as to where this new hospital will be built. The Honorable MEC must tell the people where is the hospital. I am very worried, Deputy Speaker, that open land where GF Jooste was occupied is occupied by land grabbers. That just highlights one of the worst mistakes of this administration. With the expenditure cuts on sub-program 8.5, there are more hospitals that may just vanish in the same manner as the DA government destroyed the GF Jooste Hospital. The ghost of GF Jooste will haunt this department for many, many years to come. The plight of Manenberg's people is not different from the one of people who were serviced by the Woodstock and Robbie Neuro Community Day Centers, who have been closed and people forced to go to the District 6 Community Day Center. There are a lot of challenges in that clinic. People wake up very early in the morning so they could receive medical attention. Clients are forced to go home without their prescribed medication. They have to return on a later date to fetch it. This is one of the issues that were highlighted by the nurses who came to protest in front of the legislature yesterday. They claim this is due to a shortage of staff at hospitals, especially nurses and pharmacists. This challenge may be worsened by the department's move to decrease the budget for the Cape Medical Depot, which is assisting in improving service delivery to facilities, as well as ensuring the timely purchase and distribution of adequate stock. This budget portrays a health department that is not managed well. It tells us that critical staff shortages will worsen, especially with the plans of this department, retrenching staff, which is already underway. The NHI is not a priority for the subnational government, which is trying so hard to convince itself that we are a federal state. The service delivery pressures which led to the death of a medical intern, Ilna Marquardt, who died in a tragic car crash on the way from a long shift and in 2016, are set to worsen. The plight of medical interns who are overworked will not be addressed. In this regard, I want to advise this MEC to stick to the basic rights. The usual story of clean audit is not helping as this department regressed in the last financial year. Money needs to be taken to where it's most needed for effective service delivery to the poor and vulnerable communities of the Western Cape. The ANC rejects this budget. I thank you, Deputy Speaker.
Order, Minister Mbombo to reply.
Thank you. Thank you to the chair for the input. First, just to thank the chair for the input, especially in terms of highlighting some of the issues related to the infrastructure. Yes, in terms of the infrastructure, that's why we have now an interministerial task team, which is the minister, the health, the education, the people who are putting more on infrastructure, the treasury, plus also the Department of Public Works. It's part of the cabinet service meetings. So we highlight some of the priority infrastructures, and then we keep on monitoring and evaluating. This is happening also at the HOD's level. So that's why we have managed to utilize all our budget. Actually, last year, for the first time, that we utilized the whole of the infrastructure budget, because we have put some of these things in place. The City of Cape Town, yes, we are continuing in terms of consolidation of some of the services. For example, where the services are in between 2 kilometers radius in terms of the access, so that you can make it a point that people can have an access a comprehensive package, but also at the managerial level, because that you will have, for example, 2 or 4 directors, some from us and also some from the city within one geographic area within the substructure. So it's still work under the progress, but I'm aware that the standing committee did ask the city to come and present, so I'm not sure in terms of how far is that with the standing committee. Because it's another sphere of government that we are unable to interfere, but we are continuing providing city with the allocation in order to render some of the services that they've been rendering as part of service level agreement. And then the issue of now going to Member Gillian. Again, thank you for your input. Although probably it becomes difficult to respond to each, because when you talk only about one patient, it becomes difficult, because you see about, as I indicated earlier, about 14 million patients. So therefore, what I'm going to respond about is about the general system issues. Number one, in terms of the you acknowledge the ANC for thinking in terms of the budget. Again, going back to the basics of the equitable share, which in terms of the monies that come through the taxpayers and then being allocated according to the taxpayers. So whatever government that is in place is part of the obligation in terms of the allocation. So therefore, it's a money, whether any government. Okay, do you want me to respond? Can I be protected? Or
yes,
probably?
I will protect you. Member Makaleni, allow the Minister to respond, please. And your colleagues next to you as well. Minister, you may proceed.
Okay. So either I respond or I just thank and leave. Firstly, in terms of, as I indicated, in terms of the equitable share, again, compared to the number of the population in the 2011, where there were about 5.3 million or so for the Western Cape, was sitting at 6.5 million. 75% of those people are uninsured. They're utilizing health services. So the budget that you are being allocated from the National Treasury doesn't meet the requirements. Hence, the provincial government gives us more money so that we could be able to do our function. So it's not a real terms in terms of the allocation. The mere fact that the population has increased, the mere fact that there's been a lot of immigration, and the stats SA has showed almost 8% of the population of the Eastern Cape have been moving to our facilities. You can ask the National Health Minister in terms of showing the stats around that. So the money doesn't follow the patient, as I always say. So as I always say, one, as I indicated earlier, that compared to the other provinces, for example, in Gauteng, they invoice the Mpumalanga and the Limpopo for the patients that come and utilize their services. Western Cape doesn't invoice any. Also, in addition to that, it's about also some of the, for example, as I indicated, also the risk factors. So whilst the Western Cape has managed to make it a point, for example, the issues like disease like TB, our succession treatment rate for the new cases, for example, and also our patients that are longer kept, those who are on ARVs compared to the other provinces. That doesn't mean guarantee in terms of, that's because we are the good children, we are getting more allocation. And also the other issue is about, because of the service pressures, we cannot only now sit back and more people coming to our facilities. That's why we render services even outside the facilities through home and community-based care services, of which in most instances there's no much of the recognition of the work that we do outside the services, formal services, inclusive of picking treatment for example, in the churches and all of those. So we are working around that. So what you see is not the complete picture. There are other things that we do beyond that. The mere fact that we have got the best health outcomes. The maternal mortality, people here, I think it was 70 during the time that I checked, compared to others where it even triples in other provinces where women die during childbirth. It's because of the input that is happening, going outside and do most of the things beyond. The mere fact that the poor people, in terms of the national evaluation that was done, to access health services, people who earn less than 1,200 of the poor people, it's almost 90% people who can be able to access our facilities, compared in other provinces where a person has to walk or also take a transport going from Libode, going to the St. Barnabas. I'm making just an example. So we are doing as much as we can, as I indicated, that things might not be at the best level, but we are doing something. Also to remind that when the economy of the country drops, the people who normally are affected mostly will be the health. Because as I indicated, the goods and services, the prices of the medicine is very expensive. So most of the medicine that comes from outside South Africa, it means that there are a lot of costs that are incurred, meaning you have to reduce Paul to pay Pauline because of the prices of the medicine. So if the economy was better, if we were not having this low growth of economy, health will have benefited. So the question is whose fault that the economy is very low? It impacts on us. The unemployment that is happening, it impacts on health as well, because the more people are unemployed, it means that they are unable to access to have medical aids. So it means that they depend on the state for the health services. So one has to also to consider such. Now, in terms of the complaint system, 25 days policy in terms of the response to the complaints. And this has also been embedded within the performance of the senior managements within the department. So, for example, that when there are issues that have been raised, we make it a point that we respond. It can take 2 days, it can take within seconds, it can take by this overall 25 days. So some of these examples that the member has raised, that needs to be reported, because it cannot allow a situation where you end up now putting everyone, blaming everyone. But once we have an example of who has done this, that person needs to account, which is really true, that if something happens, we need people to account. The issue of the turnover, there is no evidence. There is no evidence that within the Western Cape, there's a high staff turnover. The mere fact that the people who are sitting in the management, they've been there even during the time it was the ANC government, during the time, most of them, have got over 30 years experience working here. So that's why this government is so stable, because there's no turnover. It's the same people. It's so stable. Yes, it's so stable.
Order.
So that's why it's so stable. So you can ask anyone, Dr. Engelbrecht, when did you start? You can ask everyone.
Order. Please continue.
Okay. So you can ask everyone. In most of all the people who are in the health, in the Department of Health, these are people who have been there throughout. So that's why we have been stable around that. Now the issue of the EMS, because when there are public hearings, I always make sure that I check from the TV or whatever who is involved in terms of the public hearings. I don't recall a member being part of any EMS public hearings. But I don't recall, because I make it a point that I check. But nevertheless, it's not the point. It's not the point. The point
Order.
is that what is it that you
Order,
have
member.
done in terms
Order,
of
Minister, just 1 second.
Point
Member
of
Gillian.
order. The MEC don't have to go and check a TV to see if I'm there. I was there. She must be there
Order,
with
member.
me.
Point is taken. Minister, you may proceed.
Okay, hence I use the word I don't recall. So I use the word I don't recall. So I use the word I don't recall that, but the crux of the matter is that, as I indicated in my last mentioning in my budget speech, the issue of the EMS. So where we have taken consideration around that, but again, when I go into the areas, I always create awareness because there is a perception or expectation for some of the community members that you call an ambulance when you need to go and access, yet ambulance is for the emergency. For example, if they have been ill for the 2 weeks and all of those, and then you call an ambulance.
Order.
The ambulance
Minister, just 1 second. There's too much conversations going on in the House and the noise level is too high. I can see myself, and I'm talking about the DA corner there, please. Contain yourselves.
Okay. As I indicated that, it uses the international standards in terms of responding to the issues. But again, there are a lot of other ways in terms of people raising these issues, and we make it a point that we respond to such. Hence, we have health net pickup points for those people who might have appointments, and we have even changed it to have more pickup points in the safe environment in order to bring the services of EMS to the people. Now, with the issue of, the member has spoken about many other things, but I can understand that others were just a platform in terms of ventilating some of those. So I won't be able to respond to such, but what is important is that the member can attest, we are assisting many of the 9 provinces in order for them to have their health systems in terms of building resilience. Because at the end, health is too important. We cannot reduce it to a political football game. Because as I indicated that, if now there are more patients coming from the Eastern Cape to the Western Cape, how do we ensure we assist to build the health system in the Eastern Cape? The same applies. If now there are no oncology services in KZN, how do you deal with the cancer patients? So we cannot sit there and do nothing. So it means that when the KZN says that, can we send the registrars? Can we refer other patients to you on how they develop the budget? So if now the member is raising political issues, it means that it needs a political response. And then lastly, again, I want to thank again the Standing Committee, and I'm also looking forward to have more engagements related to all of that has been raised, because she has raised the issue of the health service training, the issue of the MIP, some of these projects, noting that some of these were already presented to the Standing Committee, and we have been engaging with them in terms of answering and responding to their questions. And also the issues about, because I didn't want to go into, but probably let me address this issue of the Gillette. The Gillette is the, what is it called this, like a under badge, what is this? Yes, it's under, yes, something like that, where initially there was an informal policy about such, because it was based on the research of anything such like even ties for the males, because it's hardly that you can change those on a weekly basis. It's a research, international research, where it says that it brings, likely to bring infection. So when it started at that time, so 1 or 2 of them, they ended up being one of the people where in that particular hospital that they will have breached or transgressed the law. So that's why now the response was bad. But I must state that this case went up to Labour Court, and it wasn't about the issue of wearing the gilet. It was about the issues related to the disrepute and all of those. I must stress about that. It's not about that, because even then, when I heard about the policy, I said that this cannot happen in terms of that we have such a policy, which now is no longer a policy, but it was not an issue related to that. As I indicated, it went to the Labour Court, it also went to the Public Service Commission. So it went further, not only it remained here. Thank you very much.
That concludes the debate on this vote. We will now suspend proceedings and resume at 1400. The House is suspended.